as the number of COVID-19 cases in Thailand is rapidly increasing, hitting new highs every day. Public health policies are a critical tool for dealing with these issues.
Yeah, and it is our honor and privilege to invite our distinguished guest, the former Prime Minister Abhisit Vejjajiva, onto the stage for our first section centered upon public health policy. Please welcome the former Prime Minister, Tan Abhisit Vejjajiva. สวัสดีครับ
สวัสดีครับ Good afternoon, everybody. Thank you to Beyond Public Health Group, who has organized and hosted this event and has given me an opportunity to share some of my thoughts with all of you on the issue of COVID, the issue of public health policy in general, and also the Sustainable Development Goals, all of which are very, very important for all of us and our future. Because the scope or the breadth of the topic is so wide, let me just dive into the first session where we will focus on the issue of public health policy as related to what we should be learning from our experience with the pandemic. And I will try to make my comments as brief as possible because there will be quite an extensive session for questions and answers where we could probably elaborate or maybe focus on particular issues of your interest. So I would just say that in this session, I would say that there are three very important lessons that need to be learned from our experience with the pandemic. The first will be related to the global picture. The second, homing in now on what has been happening here in Thailand and what kind of approach is needed for us to develop a good public health policy. And the third is maybe a guide to the future about what we need also to do to strengthen our preparedness for events or uncertainties or disruptions like the ones we faced over the last couple of years. So the first lesson, and this is an issue that I think maybe is still not being talked about enough, is one concerning the issue of global governance. COVID-19 has been declared a global pandemic, and clearly it is, like many problems that we face today, transform borders, despite the efforts of countries, even when they try to seal off their borders. The fact of the matter is this kind of issue, this kind of problem transforms borders. Otherwise, it would not be declared a global pandemic. Yet, 2 years on, we have to say that the world clearly lacks a good system of global governance in dealing with issues and problems that arise from globalization. While people, you, me, everybody in the world has been tuning in their lifestyles to the globalization phenomenon, it is clear that global system of global governance has clearly not kept up with the pace. And this is not just related to the issue of public health. We see it in a number of financial and economic issues. Cryptocurrency, for instance, is a big challenge now. We see it now with events unfolding in the Ukraine about security, where we lack a truly international, multilateral, global organizations that have the power and the cooperation from nations to deal with global problems. So let me just take you back a couple of years and imagine that if we did have a good system of global governance, I think the various countries' responses to the pandemic would be much better coordinated than now. And if you imagine going back a couple of years, in early 2020, when COVID was prevalent in Wuhan in China, and began spreading to some Asian countries. And now, or then there was a possibility, of course, of spreading to other continents. If there were a good system of global, even regional governance, and there was a coordinated response, for instance, just for the sake of argument, there was a coordinated effort on all governments to organize a shutdown, a lockdown. Would it be the case that the whole thing might have been over by 2020? All right, some of you may argue that maybe the virus will still somehow escape, but the fact of the matter is 2 years on, we do not see any kind of coordination. Today, you still have China pursuing zero COVID policy, and you have, say, the UK now lifting all restrictions, almost declaring now that it is an endemic. And yet, you still see the transmissibility of this virus across borders all the time. So just beginning with the response of various governments, and I know the WHO did try to make some efforts, although the WHO itself was also at fault in the early days as well on issues like the transmissibility of the virus and also on the wearing of masks and so on. But even today, we do not see any kind of coordinated efforts of various governments, maybe organized by some kind of multilateral international organization, to have a unified response. And this is even more costly when you look at the issue of the vaccines, particularly vaccine distribution. You had a situation where many rich countries were able to hoard the vaccines. Many had ordered vaccines to the amount of maybe 3 times what they need for their entire population in the early days. And in some of those countries now, people have had maybe even 1 or even 2 booster shots. And there are still many places around the world where people are still waiting for that first shot. And this is not just a question of unfairness or inequity, a distributional problem, but it also means that the longer we allow the virus to be transmitted anywhere in the world, there continues to be risks about new variants emerging and then coming back to reinfect the countries that had thought that they were safe because they had immunized or they thought they had immunized people within their borders because of the abundance of vaccines that they have. So I think this is a question not just about equity, but also about efficiency and effectiveness of how we deal with these kinds of problems, which are cross-border, regional, or global in nature. And I'm just surprised that governments around the world have not really been making much of an effort or even talked about this issue in terms of how we might strengthen our system of global governance in responding to the pandemic. That's one lesson that's often not talked about, and I think it's very important. So now, coming back home to Thailand, and the second lesson that I would say that we need to learn is that in the end, when there are public health issues or problems such as a pandemic, we need to take a holistic approach to this kind of problem. And I'm glad that the group organizing today's event calls itself Beyond Public Health. I think in recognition of the fact that even problems like this are not simple technical problems that can be solved by professionals or specialists. But in the end, because it relates to behavior of people in society, behavior of people in the country, it relates to the economic and social systems that are in place that will determine the evolution of the events concerning the pandemic, that we therefore somehow need to look beyond just the technical problems or seeing this as a technical health problems. Indeed, earlier on, when the pandemic struck Thailand, I was one of the few people who warned that we mustn't try to present the problem as if we had to choose between public health or the economy. In fact, what we have to think about is how we achieve maximum well-being for people in general, which means striking a balance between health, safety, and also taking care of the economy to make sure that people's livelihoods are not too adversely affected by the virus itself and also by the policies and efforts that are put in place. And when I argued that it wasn't really a choice between one or the other, I pointed out that if you thought you could choose to say coming on the side of the economy, and you don't try to control the disease, in the end, there is no way that the economy will be able to recover or grow. And that's clearly the case. And one interesting thing is, over the last couple of years, we've seen people trying to assess the effect of government announcements and policies. But I think for those people who have studied the mobility of people, how the movements of people, maybe using tools like Google Mobility or whatever, it is clear that oftentimes it wasn't necessarily related to government decisions. People made their own choices about whether they wanted to go out, about whether they want to take a risk, and so on. And so, when, and I will go through the chronology of what we went through in Thailand, when it was clear that the government became too concerned with the economy and started relaxing restrictions, in the end, when the numbers shoot up like they do now, but certainly during the Delta wave, when people were very afraid of the severity of the disease, what we saw was that in the end, operators in the services sector will not be able to do their business anyway. So it's not as if that if the government can say, okay, we'll sacrifice something on the health side and support the economy by opening everything up, that the economy can actually grow or recover in the way that is intended. On the other hand, when the restrictions become too restrictive and people begin to feel that somehow they can't get on with their lives, what happens is public sentiment builds up and goes against further government efforts to try to announce restrictions. And you could argue that the lifting of restrictions around the world, and many times here in Thailand, if you look at the timing of the restrictions and look at the numbers of infections at the time, they don't necessarily relate to each other. And I would argue that most of the lifting of restrictions in recent times, certainly this year or towards the end of last year, in almost all countries, was not because the government was now more in control of the number of infections, but it was because they could not resist the public sentiment that was crying out about their economic sufferings and wanted somehow to put an end to it. So it wasn't really a binary choice. And basically, I think that the trick has always been to make sure that the disease does not overwhelm the public health systems. So the hospitals are not overcrowded, so that we could treat people who have this disease and the degree is severe. And at the same time, making sure that we steadily immunize people and bring things back as close to normalcy as possible. I think that should have been the approach right from the start. That's not exactly quite how things turned out. And now, if we want to learn the more detailed lessons, if you like, of what has been happening, I'll just quickly run through what has been happening chronologically here in Thailand. I think the first wave back in 2020 demonstrates that, in fact, Thailand's public health system is actually quite strong. And I think you will have read also that assessments around the world would support that. When I say we had quite a strong system, was first of all, it's a matter of fact here in Thailand that, you know, our brightest people are mostly in the public health or medical profession. That's just due to value system here, certainly in my generations, and also still prevalent among the current generation, that the brightest people often go into this profession. So we have, here we have a field where we could almost say we are almost second to none compared to the rest of the world. And these very able group of personnel had been instrumental in designing some of the key aspects of Thailand's public health system right from the start, with very important innovations. We have the Thai Health Fund, we have the universal health coverage policy in place, we have a system of health volunteers, which are very, very effective in rural areas in spreading the right information and also taking care of people when there are health issues or health crises like this one. And so I think by the middle or towards the end of the 2020, Thailand's success was all for there to see, for everybody to see. We managed to control the disease very quickly. And you know, it was pretty much an undisputed success. And then when the second wave started striking us, and that is, I think, towards the end of the year, with the leakage, if you like, coming from foreign workers, particularly in provinces where there were many foreign workers around. And that carried on right until the next Songkran of the next year, where there was then a very big wave of infections as well, and the Delta variant. And I think what happened then was almost, we became victim of the success that we had in the first wave, in the first year. I think despite what the government might try to say, you have to say that there was a degree of complacency setting in. On the issue of vaccines is clearest, where I think the planned rollout of both the production and distribution of vaccines was not really tailored to deal with the breakout of infections in the beginning of the year or in the middle of the year, because the government had planned that we would start vaccinate people in the second half of that year. And of course, there was a big controversy about, in the end, how the government then procured vaccines, the quality of vaccines were being disputed, and also then the distribution. It was also clear that because of the success in the first year, and there was this feeling that I had warned about, that people started saying, hey, maybe we paid too high a price economically. That meant that for the second wave, the government was clearly much more reluctant to impose restrictions. And that contributed to the acceleration of infections that almost got out of control. And we had a situation where field hospitals had to be set up. People can still recall images of people actually dying in the streets. Added to that, I would have to say that despite the best efforts from the medical profession and those in public health sector, the breakout of the second and third wave, you could argue, exposes weaknesses elsewhere in the Thai system. That is to say, I talked about the foreign workers that somehow escaped regulations or monitoring. And it was argued that the third wave that broke out maybe from, let's say, well-to-do or influential or powerful people not observing the rules in entertainment areas like Thong Law and so on, that was responsible. So again, what I'm trying to say to you is the lesson is that this is not something that you just focus narrowly as a technical health problem. It relates to enforcement of the law. It relates to how governments respond to the public when something like this happens. And one of the things that even during the first wave, I thought was found wanting or lacking is this issue of information and communications. Even the success in the first wave, what I thought was effective communication was all when the government was reactive or defensive. So problems happen here and there. The government was able to say, look, this is how we were going to respond. But throughout the pandemic, we hear very little about the vision of governments projecting some kind of forward thinking to bring the public along exactly as to how, in terms of strategy, we are going to deal with the pandemic and bring it to an end. And I think that was particularly frustrating with the issue of the rollout of the vaccines, where there was so much controversy and confusion. And 2 years on, I have to say that we still have this problem. I don't know about you people in the audience, but you know, for the first 2 shots of vaccines, we at least had some kind of system. You know, some people were with the Ma Prom, some people were with Thai Ruam Chai, some people were in the social security scheme, some people were taken care of by their employers or organizations, both in the public and private sector. Suddenly now with the booster shot, which actually now has been proved to be important in warding off Omicron infection, there is no system. Everybody has to find this 3rd or 4th shot for themselves by, you know, trying to search as to when the vaccine or what type of vaccine would be available and have to compete to register and so on. So the whole point of this second lesson that I am highlighting is that in dealing with these kinds of issues, you have to take a holistic approach. You have to coordinate your health and economic or social responses. You have to be able to communicate with the public so they understand exactly where the country is heading or it's trying to head. And therefore, you will be able to receive good feedback and cooperation to adapt your policies as you move ahead. So before I go on to the third lesson, I should say that this problem of communication is now manifesting itself with the current situation where the government is now sort of trying to tell us that we are about to treat this as an endemic. When I say there is a problem about communication here is that I think there is a real risk that the public misunderstands what the difference is between a pandemic and an epidemic and an endemic. And I don't know about, I mean, you are more qualified on issues of medicine and public health, but I can say that for the general public, when they hear a message like this, number one, they think that the situation has improved, that it is going to be less risky and less damaging as a disease. That's not exactly what an endemic means. On the contrary, it is almost now as if when we say it's an endemic, is that we are saying that this is going to be with us no matter what we do. All right. In a way, it's almost saying that we have given up on the idea of zero COVID. And what I'm surprised is that with all the information that the government has, they should really be trying to inform and educate the public on key issues. I mean, I've been talking to my former colleagues in the political world, particularly those that can somehow communicate to those in power and in control of the situation, that, for instance, they should really have a good system of publicizing not just the number of infections, which we see daily numbers, although still with confusion because of the ATK numbers not being integrated into the system. But also the key that they should be telling the public is the number of hospitalizations, those that still have problems with their lungs, and those on respirators, ventilators, right? And break that figure down about who exactly these people are that are being hospitalized, that are still reliant on ventilators and so on. Severe cases. Have they had 2 shots, 3 shots, 4 shots? And again, 2, 3, 4 is also meaningless, because if you do 2 Sinovac or Sinopharm vaccines, that should, I think, most simplistically be counted as 1 and so on. How old these people are there young people? Are there children that can still get severe disease? Is it just being confined to people over 60, 70, 80? And also what other diseases that they may have already as risk groups. This would then give people a much clearer picture of how we're going to live with COVID, what the risks are, and what kind of action they have to take. So for instance, for me, I feel that I should be able to handle Omicron if I'm infected. But because I'm regularly in contact with my parents who are elderly, who are not well, I then have to think about the risk that they could easily catch this disease and also become severe cases, or maybe even lose their lives. This is the kind of communication that I would like to see, so that people can make informed decisions and not just being told that, oh, it's now going to be an endemic and so on. And the confusion that is going to follow will also be all about the rights of people in terms of access to healthcare. Already there are arguments going on about the inability now to get tested freely. Hospitals now begin to charge certain patients and so on. So I think, in a way, I think we have not yet learned this lesson, that we need to take a holistic approach and be able to bring the whole community, the whole country, the whole society along in a well-informed path as we move ahead. I concede that there will always be uncertainties, there will always be risks that are unforeseen, but we would be in a much better position to deal with them if we took this approach right from the start. The final lesson, my understanding that is that the time for the first session is almost up, is that despite all the progress that we have made in health and public health, and we here not just in Thailand but in the whole world, and we have to be impressed at the speed with which we can now find out the genetic sequence of the various variants and of COVID, that we can quickly design or discover a vaccine, tweak it using mRNA technology. Despite all of that, one of the key lessons is that we have to recognize that there is still a lot that we don't know. And even today, some very, very important questions, like say the subvariant of Omicron, which is more transmissible, still debatable whether it's more severe. We don't yet learn quick enough about the ability in terms of gaining immunity either from vaccines or from previous infections. We can have no knowledge or cannot be certain about whether there would emerge new variants and whether those new variants will be more transmissible or more severe or would be resistant to the immunity that we gain from either vaccines that are existing vaccines or even if we had previous infections. And so we have to brace ourselves for continued uncertainties and risk. And there are three things here that I think is important. Number one, that means that the risk management system, whether you look at it from the point of view of public health, from the point of view of managing the economy and so on, needs to be strengthened. The second is that we have gathered so much information over the last couple of years. We have so much information about people's behavior, about their status concerning health, concerning vaccination, concerning assistance that they get economically and otherwise. We need to consolidate this information system and use it much more effectively and efficiently to deal with all the problems that we've been through that might re-emerge. And there are also other lessons that we could learn, but I don't have much time to go into detail. For instance, I think and I'll talk about this when we do the second session. One of the things that COVID has done is to expose the degree of inequality and inequity in most societies and also in Thailand. And we need also to design better policies to recognize the uneven impact on various groups of people from the pandemic, from the measures that governments impose. Simply put, for instance, social distancing, which is obviously the key to preventing infection, is clearly a luxury good. When you live in congested communities, when you engage in manual work, you can't work from home. I mean, all this is almost a luxury. The informal sector in the economy suffers much more. So economic assistance policy should be designed with better targeting to make sure that we use the resources we have effectively. And the one last issue that I will mention is on the issue of vaccines itself. I have always been arguing that our intellectual property system needs to be reformed. I don't see why we should allow companies that, although they are very instrumental in rolling out vaccines and discovering this, to make huge profits. I'm not saying that they should not be rewarded, but there should be a better system. And we have seen a glimpse of it in the case of AstraZeneca, where the public sector contributes upfront to the research for this in exchange for having this vaccine be available at cost and not at huge profit margins. These are the kinds of lessons that I think we need to learn. And I think there is a lot to learn. We need to discuss it much, much more at the global level, at the regional level, and at this kind of level, so that we are better prepared for the future and improve the design of our public health system. I think that probably should be it for the first session. Thank you.
Thank you, Abhisit Vejjajiva, so much for your visionary and perceptive speech on our public health policies, especially the clear parts such as the global governance, where we lack of global organization. As a result, many countries cannot coordinate on policies and not agreeing on restrictions, which really needed to be taken care of.
Yeah, so now we'd like to hear the audience's opinion on the matter in our Q&A session with our first moderator, Kun Thitikan Jingthira Panit, who's also the co-founder and the academic director of Beyond Public Health. Please welcome Kun Thitikan.
Thank you, Mr. Peen Pongsuklishkun, and good afternoon, everyone. My name is Thitikan Jingthira, and first of all, I would like to say thank you to our former Prime Minister, Than Abhisit Vejjajiva, for delivering a very good presentation. Now we have come to the Q&A section based on the presentation given by our former Prime Minister. And since we have so many questions delivering to us from the registration form, we have picked the best questions and would like the former Prime Minister to answer and express his opinions toward the questions. We will start with the first question. On today, Thailand has reached almost 40,000 new COVID cases with 45 deaths, leading to many public criticisms on how the authority deals with the problem. Of all the public frustrations following the several new waves of COVID-19 outbreak, what do you think are some of the structural obstacles that Thailand is facing? And what do you think is the solution to those obstacles?
Yeah, I touched on this during the presentation. I think we are now moving into a stage, like in many countries, where governments can no longer resist the pressure from the economic demands. So they are, I think most countries are now completely unwilling to place stringent restrictions in trying to control the disease. They are, in a way, supported by the fact that, yes, it is true that the Omicron variant, which is now the dominant variant, appears to be less severe. But as I mentioned, it doesn't mean that everybody is safe. And therefore, what I think needs to be done is my demand for some kind of strategic vision that the government must share with the public. At the moment, when the government starts saying, oh, maybe we should not publish the daily numbers of infections, nobody in the public thinks that that's strategic. They think it's because they're trying to hide the numbers. And when the government says, oh, well, maybe the access to health would no longer be free like over the last 2 years. Again, the public doesn't think that's because this is turning into an endemic. The public thinks, oh, maybe the government's running out of money. So I think the government needs to be forthright about exactly what the thinking, what the rationale behind the moves that they are making. And I think some key statistics should be presented. So I mentioned, for instance, that if they're going to say it's more important to look at the number of hospitalized people, number of people with severe cases, number of people on ventilators, then tell us, are the people in hospitals fully vaccinated? Are the people hospitalized or elderly people? So the public can gain knowledge and manage their own risks. Okay, since the government is no longer willing to make restrictions or to give out orders about how we should live our lives. So that's the first thing. The second thing is whether you think it's turning into an endemic or not. You have to say that the vaccination program is still essential. And I don't understand why the government that has all the information about you and me, how many shots we've all had, cannot actually organize and prioritize who should be getting the next shot, what kind of vaccine you should get, and have this rollout plan like that, so that the immunization program would be able to deal with the continued infections much more effectively. I think this is the kind of thing that I would like to see.
Thank you for your wonderful answer, Mr. Former Prime Minister. Now, I would like to ask you the second question. It's about the international comments on Thailand vaccines policy. So the question is, according to the international comments on the Thai vaccine policy, the Thailand has turned from one of the best countries in terms of response to COVID-19 to one of the worst. Would you think it is true, or would you think that it is not?
Yeah, I mentioned that I think there was a degree of complacency that set in after the initial success. I don't know if this is any consolation, but I noticed that this seems to be the case with all the countries that were successful in the first year. Many countries that were successful at controlling the infections the first year all appear to have a very slow vaccination program in terms of rolling out and distribution. But as I say, is that a consolation? I don't know, but we have to admit the fact that I think there was a degree of complacency, and that was where I think things became unstuck because of the slow vaccination rollout.
Thank you for your answer, Mr. Former Prime Minister. Now moving on to the next question. Now let's talk about the Thailand's top priority during this time of pandemic.
Sorry?
Okay, so as you can see in the screen, according to the poll asking whether which topic should be the top priority during this time of the COVID pandemic, we found out that the healthcare accessibility and affordability are the major concerns. And the question is, do you agree with this poll result, or do you think that there are all the concerns that we should be focusing more on? Okay,
right, let me just have a quick look. I mean, all the issues that you've, presumably this is not an open choice, right? You gave them these choices and voted, or was it an open question?
Yes, we give them like the
choices. Yeah, they're all important, and I can see that. I mean, accessibility and affordability obviously is something that is most desirable. But again, I mean, what came second is vaccination. Again, the preventive measures are equally important. The others, I guess, are a little more detailed about the testing, about the communication, which I also emphasized earlier, but also community-based. But I would say one thing that could help with all of this, and that is to say that if you look at the way our health system has been designed, if you look at the role of non-governmental organizations when the situation was really bad last year, you sort of wonder whether the government can do so much more to facilitate them. You know, we had so many effective networks of ordinary people helping people find beds, hospitals, telling them where they can get vaccines, where they can get testing. And that's the kind of system we would like to promote. You will see that I mentioned at the start the role of our health volunteers. I think they were very effective in rural areas. They're as effective as any app you could have designed on tracing and so on. And you will notice how the worst place in terms of coordinating system is actually Bangkok. And that's because we have a very fragmented system here. And so I would say that if we could redesign where there is better coordination and better participation from non-governmental players, all the priorities that have been highlighted here could be more effectively addressed.
Thank you for your answer, Mr. Former Prime Minister. Now we are on the last question. What can we, as the Thai citizens and also especially as medical students can contribute to our nation, especially during this time of pandemic?
Well, you do the job. You do your job. You inform people, and I think you have to make some noise about where improvements can be made. You know, I should mention that one of the things that I forgot to say was that when compared to Western countries, we are blessed with the fact that we have a public that trusts the medical profession, that trusts the experts. So we don't have the headaches of people protesting against wearing masks, protesting against vaccination. And I think the degree of compliance on the whole is pretty good. I think it surprises a lot of people. We often say to ourselves that Thai people are never disciplined. But I think during the first year, certainly of the pandemic, I thought the public responded to government's requests or orders very, very well. So I think you can play a part in reflecting both the successes and failures, the strengths and the weaknesses, so that we can all help to design a better system. And I think you have an audience that are willing to listen to you because they trust you more than they trust politicians.
Thank you, Mr. Former Prime Minister, and thank you for all your visionary answers. And next, I would like to pass the spotlight back to the MC to continue on to the next section. Thank you.
Let me just add one more point that I would like to make before we move on to the SDGs or whatever. Just a thought exercise for you and for me, because I don't think anyone has the answer. Do you know when the pandemic broke out, I kept searching on the net about how the Spanish flu ended. I was never able to find a proper answer. And I was surprised people kept comparing this to, the Spanish flu 100 years apart and all that. But in the end, the Spanish flu seems to have faded out after about 2-3 years and maybe turn into normal flu or whatever. The question that we should ask ourselves, and I'll leave you with this thought exercise. How come 100 years on, with all the knowledge that we have gained, with the new technology, we couldn't bring COVID to an end sooner than the Spanish flu ended? And maybe we will have to look when this is all finished, if it ever finishes. Despite all the progress we make, have we been able to deal with something like this better than the people 100 years ago? Just a final thought exercise for you.
That was a great question, Mr. Former Prime Minister. Thank you for your opinions and answers. And now I would like to pass on the spotlight back to the MC to continue on to the next section. Thank you.
All right, so thank you, Kuntipikan. That was such a very fruitful session. And the exercise question at the end about the Spanish flu is really something that we need to consider, right, team?
Yeah, most definitely, Vivi. I thought it was very intriguing and I was fond of the question as well, because if you think about it, the pandemic during that time, the technology was not on par as now 100%. And it is very intriguing. I'm very surprised, and I'll go back and have my train of thought later. But
I thought you were going to have the answer for me.
I'm afraid not now, sir. But I'll definitely think about it.